So I'm Cameron Wolfe. I'm one of the Associate Professor of Medicine in Infectious Disease Division here at Duke. If you think back to 2 years ago, we didn't know what COVID looked like, we didn't know how to treat it, we didn't have any medicines in our arsenal, certainly didn't have any vaccines. And so, part of the role over the last couple of years, I guess, has been to help run some of the trials within the hospital and for outpatients who have COVID, to help roll out vaccines when they became available. Early on, when we started to see early reports out of Wuhan emerging, I think one of the things that we realized pretty early on is that Duke actually was sort of uniquely exposed in a way. We have a university partnership with Wuhan, in fact, and have, prior to 2020, very frequent exchange of fellows and academicians back and forth from China. And in fact had travellers on our campus in January, February and March who were directly impacted by this. So that sort of led a small group of us to begin to think both internally in the hospital, but then also from the university's perspective, how would they handle that? What would it mean for our faculty who want to travel? What does it mean for our staff and students who are based in China? What does it mean for a hospital to face the prospect of having patients present? And of course, at that point, we didn't know how busy that would become. I certainly had no prediction of what the last 2.5 years would have been. We're certainly in a better phase, let me put it that way. We're in a phase when everyone's had the chance to get vaccinated. We have plentiful array of safe and effective vaccines, safe and effective treatments, heaven forbid someone still gets sick. We know a ton more than we ever did about ways of keeping COVID out of households and out of your setting. I think people's perhaps fragmented trust in messaging will be a challenge that we have to really think about. We're for the first time, healthcare, I think, really fell foul of the country getting its information through many disparate different channels, some of which are more factual and some of which are hysterical and not factual. That had been true for some time, I think, in the political arena, and this was the first time it really bled into healthcare. I think our trust in public health institutions may have been battered around a little bit. If the end point of that is that we all look very carefully, particularly large public health settings like, let's take the CDC or the WHO, for example, if they're able to look at the way they direct their message to the public and actually come out of it in a better place, then that's a good thing.